First of all, I want to say that postpartum depression, or PPD, is a real thing. And second of all, I want those who suffer from it or have suffered from it to know that it isn't their fault and has absolutely nothing to do with their love for their child or their ability to be a good parent. And it isn't a character flaw or a lack of faith if you're a Christian. So what is PPD? Postpartum or postnatal depression, it's a type of depression that affects some women after having birth, and typically it develops within 4 to 6 weeks after giving birth, but it can sometimes take several months to appear. Symptoms include sadness, changes in sleeping and eating patterns, low energy, fatigue, anxiety, irritability, feeling overwhelmed and trapped, frequent tears, loss of libido or low motivation or self-worth, and just general feelings of inadequacy. Some mothers may also struggle with scary thoughts of hurting themselves or their babies. And although this very rarely happens, the thoughts can be very distressing. PPD is also far more common than people realize, especially as mothers often struggle to tell people that they're suffering. Research tells us that approximately 1 in 7 new mothers will suffer from PPD. Now, postpartum depression is not the same as baby blues, which affects many women just for a few days after giving birth. However, if the woman's ability to go about her day-to-day life is significantly undermined, it's more likely she has postpartum depression. The exact cause is unclear, but some risk factors have been linked to it. Depression is usually caused by either emotional, traumatic, or some stressful events, or some biological factor which leads to an imbalance in the brain chemicals or the neurotransmitters as it's called. Or sometimes it's both. PPD can also include hormonal changes. After giving birth, estrogen and progesterone levels may drop considerably, as well as just the emotional impact of the health consequences following childbirth. And often for some mothers, it's a lack of sleep. If there's a history of mental health problems such as depression or previous postpartum depression, that can also contribute. And women who have bipolar disorder have a higher risk of developing postpartum depression compared with other mothers. Breastfeeding difficulties may be a factor, as new mothers with breastfeeding difficulties in the first 2 weeks after giving birth have a higher risk of postpartum depression. The good news is that PPD can be treated. Anyone with symptoms should see their doctor immediately. Effective treatment is possible with the help of support groups and psychotherapy and sometimes medication. Getting treatment can make a big difference to not just the mother, but also her capacity to bond well with her child and to deal with her feelings of shame and guilt. It can help her feel less alone, as she realizes that her experience is something that many women also share. And as I've said, it can help her realize that she is a loving and good parent, since her PPD symptoms has nothing to do with her capacity to love or to be a good parent. A significant proportion of mothers with PPD don't tell people how they feel because they feel ashamed. So partners, family, friends, pick up on the signs, if you're able to, of postpartum depression, and at the earlier stage the better, and encourage them to get help as soon as possible. Although recovery might sometimes take several months, and in some cases even longer, it is, as I said, treatable. The mother's most important step on the road to treatment and recovery is to acknowledge the problem. Family and partner and close friend support can have a major impact on a fast recovery. A patient with severe postpartum depression may be referred to a team of specialists, including psychiatrists, psychologists, occupational therapists, and specialized nurses. There are several PPD clinics available in hospitals around the city with qualified specialists who have had good success with treating PPD. If the doctors feel that it's necessary and the patient may be at risk for harming herself or her child, she may be hospitalized in a mental health clinic. Remember that postpartum depression affects millions of women every year, Hear me when I say this. This is not your fault. And please, if this sounds like you or someone you love, please get help for yourself or your loved one.